As men age, the prostate gland naturally grows, but for many, that growth can lead to uncomfortable and sometimes serious urinary symptoms. The prostate is a small walnut-sized gland located just below the bladder. Its main job is to help produce the fluid that carries sperm, commonly known as semen. When it gets too big, it can press against the urethra, the tube that carries urine out, and that's when problems begin. Here is what you need to know about prostate enlargement, medically known as benign prostatic hyperplasia (BPH), that affects millions of men as they age. For many men, the first signs are subtle: a slow urine stream, the need to get up at night, or a feeling that the bladder never quite empties.
Prostate enlarging is not a disease on its own. It only becomes a problem when it starts blocking urine. That's when it becomes a disease. But prostate enlargement is a normal aging process, just like the way we get beards or we get white hair or we get bald.
According to a study published in the American Urology Association journal, Black men and Hispanic or Latino men are 41% more likely to develop BPH than white men.
It's a fairly common condition to all men. By age 50, about 30 to 40% of men already their prostate have enlarged. By the age of 80 years, 90% of men have prostate enlargement. Very common in African men and happens, again, because of age. So the risk factor is age. All of us as we age, the prostate enlarges.
Apart from age, Dr. Muigai highlights several additional risk factors for prostate enlargement.
The African heritage, for African men, the prostate is bigger than our Caucasian counterpart because of race. And the other risk factor is family history. All of us as we age, the prostate enlarges, but if it happens in your family, then the siblings, the sons, are also going to be affected by prostate enlargement.
Men are urged to watch for key warning signs that may indicate prostate enlargement. These symptoms include a weak or interrupted urine stream, difficulty starting urination, a frequent or urgent need to urinate, particularly at night, a sensation of incomplete bladder emptying, and dribbling at the end of urination.
Other men experience something called hesitancy, and that is you go to the toilet, you're feeling you're pressed, but then when you reach there, urine does not come out. It is like it is thinking, do I need to come out or not? Then it comes out, so it is hesitating. Or it is coming out and then it stops midstream, okay? That is called intermittency. For other men, they get complete retention. So you're having urge to pass urine. When you go there, urine fails to come out completely, and it will not come out until you go to the hospital.
While these symptoms can be frustrating, they typically develop gradually and are often manageable, especially when addressed early. However, Dr. Muigai warns that if left untreated, persistent symptoms of prostate enlargement can lead to more serious complications. These include recurrent urinary tract infections due to retained urine and, in some cases, the presence of blood in the urine.
It might damage your kidneys, and there are men who have gotten kidney failure because of prostate enlargement, or you get other conditions like bladder stones.
The diagnostic process for prostate enlargement begins with a thorough clinical evaluation, where a healthcare provider examines the patient and takes a detailed medical history. According to Dr. Muigai, this initial step is crucial in identifying symptoms and ruling out other conditions. Following the clinical assessment, patients are typically referred for laboratory tests and an ultrasound scan, which help confirm the diagnosis.
It will tell us what is the size of the prostate, how much urine are you retaining, does that have effect on the kidney, is it going upward, is it damaging your kidney? And then we usually do other tests like a urinalysis to make sure you don't have a urinary tract infection. We are going to check your kidneys, going to check your blood whether you have infection, and most also importantly is that we do a test called a PSA, prostate specific antigen, to also make sure that it is not cancer you're having.
Once the diagnosis is confirmed, doctors assess the severity of the condition to determine the most appropriate treatment plan. Dr. Muigai explains that treatment options vary depending on the patient's symptoms, prostate size, and overall health.
So the fact that ultrasound has shown that you have an enlarged prostate and you're not symptomatic does not need unique treatment.
Fortunately, a wide range of treatment options are available for managing prostate enlargement, offering hope and relief to many men. Treatment typically falls into three main categories: lifestyle modifications, medical therapy, and surgical intervention. Lifestyle changes may include reducing caffeine and alcohol intake, limiting fluid consumption before bedtime, and adopting healthier eating habits.
Now, once we do that, there are people we put on medical therapy, medicine, tablets. So we'll start you on tablets, and these tablets are going to, one, they're going to open up the urethra, or they're going to shrink the prostate so that the urine is flowing out better.
While many men with prostate enlargement respond well to medication and lifestyle changes, there are cases where surgery becomes necessary. Such include those who do not respond to medical therapy, as well as those facing serious complications like recurrent urinary tract infections, those who pass blood in their urine, and individuals suffering from urine retention. Surgery is also advised for men who develop bladder stones or face the risk of kidney failure linked to the condition. Dr. Muigai says myths and misconceptions continue to cloud public understanding of the condition. One common myth among men is the belief that prostate enlargement is caused by inadequate sexual activity, a claim Dr. Muigai firmly dismisses as false.
The other myth I've had is when women bring their men or their husbands to the clinic and they leave and the woman asks me, Daktari, naweza pata hii shida pia mimi? Can I get this problem? So it is not sexually transmitted. Prostate is only in men. And also men think that if you have surgery for prostate enlargement, that is the end of your sexual life. You'll not be able to get an erection. You cannot get children.
While awareness around BPH has improved in urban areas, a significant barrier remains: men's reluctance to seek medical help.
So when they come to the hospital, it's because things have gone out of the hand and they're either brought in by their wives or by their daughters, but they will not come just on their own.
According to the Kenya Association of Urological Surgeons, BPH is the most common urological condition in men over 50, yet less than 40% of symptomatic men in Kenya seek treatment, often due to stigma, lack of awareness, or limited access to specialized care.
Every urologist running a urology clinic anywhere, probably 50 or 60% of his patients will be men with benign prostate enlargement. However, when you go to the villages or you go to far-flung hospitals, you'll find men who have stayed with this condition for years.
Dr. Muigai emphasizes that unlike prostate cancer, benign prostate hyperplasia or prostate enlargement does not require routine checkups or screenings.
What we tell men is, if you find there are changes in the way you are passing urine, then you know there is a problem. You know it is not normal. Go to the hospital.
Though BPH is not cancer, some symptoms overlap with prostate cancer, which makes it essential to consult a doctor when problems arise. A simple physical examination along with a prostate-specific antigen PSA blood test can help determine the cause.
Prostate enlargement does not cause prostate cancer. It is not a risk factor for prostate cancer. But you can have both prostate cancer and prostate enlargement together.
Prostate enlargement is a natural part of aging for many men, but it doesn't have to mean living with discomfort or disrupted sleep. If you are experiencing urinary symptoms, don't ignore them. Early diagnosis and treatment can make a big difference. Nuru Abdulaziz for Willow Health Explainers.